And we're close to Asia and the South Pacific, so yes, we expect dengue to arrive in travellers any time in the year. And the travellers, of course, could be visitors to Australia from abroad, or they can be Australians who have gone to holiday in Asia, or recent migrants in Australia who have gone back to visit friends and families back home. The thing, I guess, what has come as a bit of a surprise to many of us is this very early summer rain. It's dragged on and been very intense, a very good rainfall overnight here in Cairns, of course. But we know that this will fill up all the containers that the dengue mosquitoes breed in, and we also know that once the rain clears, it's going to be hot and steamy until the wet season well and truly arrives. And this combination of this time of the year with full containers with these early summer rains and the hot temperatures that are coming soon, it's ideal for the dengue mosquito. It's priming us, if you like, for dengue outbreaks. So what triggers a dengue outbreak? It's that traveller from abroad who unknowingly brings the virus back with them. The incubation period, the time between someone gets infected by a mosquito bite and the time someone gets sick, is perhaps around about a week. And in that time, someone can come back from a resort in Bali into a suburb here in Cairns, or to suburban Townsville, for example. And that's all it takes. So a traveller from abroad brings the virus with them, and local mosquitoes are waiting for that virus. We have, of course, asked our vector control people, our DART team, to go and look at the places where those people have been. And fortunately, we've just caught them before the rain, if you like. They did not have a lot of breeding around those properties, but that could change very rapidly after this rain and with the warmer temperatures.
So you don't have any concern about those 3 cases spreading?
I'm not going to say we don't have any concern. We always have a degree of concern, particularly from this time of the year, moving into the warmer months, increased international travel with summer and Christmas holidays and so on and so forth. Schools breaking up, university, end of year university people travelling. So it's our dengue season from here on through into the wet season. And on top of it, you're aware that we've now just recognised someone in Townsville, in the suburb of Garbutt, who's got dengue, and that person has not travelled. So that person's picked it up locally. Which means that there must have been a traveller we didn't recognise who's infected local mosquitoes. Fortunately, again, not a lot of local mosquito breeding around that person's property in Garbutt. And talking to local doctors who service that part of the city, they're not aware of people with hindsight who might have had dengue. Urban big cities in Asia, we know, are hotspots for dengue from time to time. And that's where we get exposed. They have, many parts of Asia have endemic, entrenched dengue. It's not just sporadic dengue outbreaks like we get. They've got year-round outbreaks which can be huge at certain times. And travellers who visit those circumstances, those cities, could well be exposed. And with international travel, what it is these days, they can be on a plane in Asia one day and back here in suburban North Queensland the next.
So you're saying that the dengue outbreak has officially started, the dengue season?
Well, the dengue season certainly has. We usually start to worry about the time of the first early summer rains, and these have been very good summer rains, because we know it's followed by the hot season build up to the true wet. So yes, it is. And on top of that, we've got these travellers, and we've got a locally acquired case in Townsville. And it's as well as responding with the DART team, it's also time to remind locals here in North Queensland to try to make our households and our businesses as least friendly to the dengue mosquito as possible, to get rid of breeding sites. Artificial containers, plastic bowls in the backyard, to either dispose of them or turn them upside down, to fill in pot plant bases with sand so they're not breeding mosquitoes, to get rid of, or somehow get rid of the palm fronds that litter our residences, and so on. Bird baths to try and clean them out, to empty them out of water after the rain, dog bowls that stay there forever. All those sorts of water containers, man-made containers, palm frond bases in and around our homes and our businesses these are where the dengue mosquito thrives, and they will be thriving after this rain in the warmer months, warmer weeks ahead of us.
Dengue type 2, which is different to what the epidemic was, dengue 3 earlier this year, and the case in Townsville was dengue 1.
Is that a concern for you guys?
We respond to each type equally. The concern is really to the community. If you had dengue 3 earlier this year, you definitely do not want to catch dengue 2 or 1 or 4 this year, because that's when we see the more severe complications of dengue. But our response is to control mosquitoes, irrespective of what type they're carrying. So we have a very well-established protocol to respond to imported cases and locally acquired cases. Bear in mind that the dengue mosquito does not disperse widely, so what we have is very localised responses. So therefore it's very important that the members of the public who suspect they've got dengue need to go to a doctor, get a blood test. The public health nurses will establish a travel history, and that will determine where we do mosquito control work. So take-home message from this is, if you're developing any sort of dengue type symptoms, don't waste any time in getting to a doctor and getting a blood test.
A sudden onset of a high fever, headaches, usually in the front of the head or around the eyes, muscle aches and pains, and a rash that's quite a blotchy rash, can be generalised across the body. And it's these sorts of things that we're urging our GPs to let us know about, particularly if there's been a travel history, of course, or particularly if someone lives in Garbutt at the moment, to be alert to the symptom complex and let us know. The way we respond to dengue is as good as it gets. Perhaps Singapore has a slightly more efficient model than we do, but the way we respond with surveillance and mosquito control and community awareness campaigns and so on is probably cutting edge. The issue is, well, how do we prevent this in the first instance? And that goes back so often to the community with these sorts of reminders about the sorts of breeding sites that are out there in our backyards, in our businesses, and trying to reduce that risk to make our environment as dengue mosquito unfriendly as possible.
I guess I take a degree of satisfaction that during the responses to these most recent cases, we're not finding a lot of mosquito breeding sites. To me, that indicates that the public are taking on board the message in general, that there is benefit in protecting themselves and their family and the community against dengue mosquitoes by taking on those very simple precautions. And it's a matter of keeping that behaviour going week in, week out during the wet season. Now there always will be a very minor element of the community which don't hear those messages, and there are avenues which council can take recourse to if they need to. So I'm certainly an advocate that most people, if they take the time to explain what is actually involved, most people, most of the time, understand that there's a mutual benefit to themselves and their family and the community. And I think that's the way North Queensland would prefer to continue to operate, where people are educated and understand what the message is without having to go to any sort of punitive measures. But the public need to be aware that there is legislation in place which says that you're not allowed to breed dengue mosquito breeding sites.